Okay, this video is for you skip and bingers or sporadic eaters. So people that know that their problem is not so much an emotional or psychological attachment to food, but it's this just sort of not thinking about food until it's too late. And the problem behind this is usually people have sort of carried this teenage or young adult mentality about food. And when we're teenagers and adults, most of the time we don't have to think about food. But a lot of the research these days points to the fact that if you're above the age of 35 and you're of normal weight, you think about food more on average than the average person. And so it's really important to have some way of thinking about food again. And I know that seems counterintuitive. If you want to weigh less, you have to think about food more. But you do, and I'm going to explain why. So the skip and binger or sporadic eater usually has some sort of hectic schedule throughout the day. Either they're with kids all day, excuse me, they're with kids all day and they're chasing them around and they don't have time to eat or stop, or they are at a work site and they're busy and they're in meetings and they just forget to eat. And so by the time they do finally eat is usually late in the day, so usually like 4 or 5 p.m. This type of eater usually will consume most of their daily calories between 6 and 10 p.m., which we know is not a healthy thing because for anyone that has not had the weight loss surgery, it's eat breakfast like a king, lunch like a prince, dinner like a pauper. So it gets larger, smaller throughout the day if you're going to do a large meal. And obviously, if you've had the weight loss surgery, you can't do a large meal because you can only eat about the size of the palm of your hand. So for a skip and binger or sporadic eater, my advice is to obviously come up with a way to eat more regularly. And for many people, what that means is setting an alarm on your phone that goes off every 2 to 3 hours that just says eat, that just reminds you to eat. And as simple as it sounds, sometimes people need that to get in the habit of every 2 to 3 hours thinking about food. And then if you're at some place where you're on the go, like maybe you're a truck driver or maybe you work outside of your car, you're in sales and you're always in your car, where you don't have access to a fridge, then during the days that you have off, prepping meals and investing in a really nice cooler, a really good cooler, really good glass Tupperware. If it doesn't look good, if it doesn't look visually appealing, you're not going to eat it. And so we need to have things that look really nice. A good, clean cooler, one that does not smell, one that's clean and fresh, and good, clean glassware that you can see through and everything looks visually appealing. So that's one part of the whole thing. The other thing is coming up with snacks that you can eat regularly throughout the day. So I am not a nutritionist, I'm a psychologist, and so I sort of leave the what of that to a nutritionist. But coming up with things that might be healthier that you can have post-operatively in terms of like red pepper strips and hummus or pine nuts or a piece of string cheese or a protein shake or a hard-boiled egg. So making sure that you have things throughout the day so that every 2 to 3 hours you're having something so that by the time you get home, 5 or 6 p.m., you're not starving at that point and more apt to make bad decisions. And it does take some time. And I know a lot of you guys have kids, you have busy lives. Even if you don't have kids, you've got busy lives. And so you will have to take extra time to think about food again, to meal prep throughout the week or once a month. There are people that meal prep once a month and then they freeze everything in de-thawed. And there's even, I think it's called onceamonthmeals.com where you can look up recipes. So figuring out what that is, what that looks like for me. Sometimes it can be every morning. Every morning you get up 20 minutes early and you prep all the food for that day. That's fine too. But figuring out, what am I going to do differently? Because if we keep on doing the same thing we've always done, you keep on getting the same thing you've always got. So you do have to change the behavior. And unfortunately, there are people that go into weight loss surgery thinking, having this sort of fantasy of like, this is the magic bullet. I don't have to do anything to change. This is going to do everything for me. And that unfortunately is not the case. You will lose weight, but it's not going to be the same quality and it's not going to last the same amount if you don't also make the lifestyle changes at the same time. Okay, so I hope that helps you guys that are sporadic, skip and bingers. The other last tip that I'll just say is that you need to set a cutoff time before bed of 2 to 3 hours. So if you go to bed at 10 every night, around 7 or 8 p.m. needs to be the cutoff time. No-go zone, nothing. No, not even a chewy probiotic. Nothing, because we don't work well in gray area, and we need black or white. And so if you can create that 7 to 10 p.m. period, you're, number one, going to save yourself from a lot of excessive calories, which is when most people tend to get into trouble. But B, you're going to create that natural hunger again, so that when you wake up in the morning, you naturally want to break the fast with breakfast and start your day in a healthy way. All right? Thanks, guys.